So before we go into the immune causes or the topic proper for today, ANCA vasculitis, you must know what and all can cause pulmonary renal syndrome. So a cardiac failure, okay, an acute decompensated heart failure, okay, can present as a pulmonary renal syndrome, right? So there can be both hypoxia, volume overload, as well as a renal failure. So that is a cause of a pulmonary renal syndrome. Talk about infections, be it bacterial infections or viral infections, they can also lead to simultaneous respiratory and renal failure. So examples quoted in the tabular column are severe bacterial pneumonia, for example, with Legionella or a hantavirus infection, which I feel is less picked up because we really don't test for it, and opportunistic infections in the immunocompromised host, that is patients post kidney transplantation. So different type of infections can cause a pulmonary renal syndrome in the post-transplant setting. And other causes, you can have sepsis and MODS, which can cause failure in both the systems. Paraquat poisoning. Okay, so that's interesting. So among the poisoning, paraquat poisoning, a very, very dreaded pesticide. Okay, um, prevalent in Telangana, where I did my training. So we had so many cases of paraquat poisoning, and if they've really consumed, then we really couldn't save most of them. Okay, and renal vein or inferior vena cava thrombosis with pulmonary emboli is a rare cause of pulmonary renal syndrome. So this tabular column is just to tell you that pulmonary renal syndrome means there's problem in the respiratory system and problem in the renal system, and there are different causes that can cause this kind of a scenario.